I'm Dr. Dale Michaels, Chief Medical Officer of SERPA-ACO. I wanted to take a moment to explain what it means to each of us to be a part of a patient-centered medical home, or PCMH. This concept has been developing over the last several years. We are shifting our medical care from meeting the needs of the physicians in our office to meeting the patient's needs first. Patient-centered medical homes involve all of us in the office from beginning to end. Let's take a look at each of the important items that affect how we will be helping patients. Expanding access to care is the first one to look at. Each physician, PA, and APRN will have empty slots built into their schedule to see patients when they need to be seen. This will require ongoing adjustments as we work to keep everybody busy and still have enough open slots for any given day. It will take careful monitoring by all staff to make sure that we get patients seen and don't overload the schedule with patients who have chronic rather than acute conditions. We also know we have busier days and lighter days where we get fewer phone calls. Our goal is to schedule more of the follow-ups and chronic condition visits on days where we don't have as many people calling in. This will require teamwork. For many offices, it also means expanding our hours to an evening or Saturday morning. While none of us like the extra hours, it will help us care for those patients who have acute needs and can't get to the office during regular hours. Continuity of care is another important aspect of the PCMH. As family physicians, we can care for about 90% of the problems we see. Other primary care specialties are similar. That means we don't have to send patients to other offices to be evaluated. That helps us control medical costs for our patients. Our third piece of the puzzle relates to the comprehensive care we provide. When our patients do need other specialists to help us care for a problem, it is extremely important that we get timely and complete reports back from the specialist. Making sure we can provide the follow-up our patients need is an important part of that. Sometimes specialty physicians ask to see the patient in follow-up when we could provide them a report from our visit without another visit to the specialist. We will have to work together so when we see the patient, we make sure that information is communicated about our visit. It also means we need to make sure we provide any needed information to the specialist before our patients visit to see them. That can help avoid extra costs and charges to the medical system. It is important for all of us to know when a patient is being followed up after a specialist visit so we make sure we have the most current information. It's all part of providing comprehensive care to our patients. The next issue we are dealing with is the care coordination. This is a new position in most offices, and we'll deal with that position in another session. What the care coordinators do is critical to patient care, particularly to those patients who have been in the hospital or the emergency room, or have moved from the hospital to the nursing home and now have moved back home. Our experience has been that most, if not all, of these patients are on different medications than our records show. In addition, there's often confusion about follow-up appointment and tests or procedures that are to be done after the patient leaves the hospital. Each of these aspects of the PCMH are important to all of this. As we get better at doing this, we expect that we will find we are doing things differently than we have in the past. It is a challenge, but will mean good care done in a better way to be more supportive of our patients.